if you are looking for a grit health program, then you've landed in the right spot. My name's Lauren Listowskis. I'm the program director at Grit Health. I'm a 5 and almost a half year cervical cancer survivor. And tonight we have a really special program planned. It is the third and final part of our Cancer Research and You series. So we, in the first part, talked about clinical trials. And then in the second part, we had the Grit Health team on talking about patient experience research. And then tonight, by far, probably my most favorite, we are actually hearing from real people who partook in real research studies that relate to their cancer. So I'm excited to actually hear from the people that been there, done that. So I'm really glad you could join us. The program is being recorded, and we will send a follow-up email out with the recording once it's available, and you'll get an email from me with that probably within the next week and a half, so be on the lookout for that. And I just want to thank you all for attending. Thank you again, especially to our speakers who agreed to share an hour of their time with us. And this is meant to just be informational, share our experiences. Of course, any medical decision should always be up to you and your healthcare team. And if you have any questions or comments, you can absolutely write them in the chat at any time. And we will be pausing throughout the hour together for me to address any of those questions with our speakers. So you don't have to wait. If the question pops into your mind, go ahead, type it out. You don't have to wait. And with that being said, we will go ahead and get started. What I'll do first is kind of let our speakers introduce themselves really quickly. And then I have some questions for them that I've prepared that will probably be questions that you would have had for them as well about participating in cancer research. So thank you all again. Comments, questions, put them in the chat. And thank you again for being here. So we will go ahead and get started with one of our speakers. Jennifer Brouwer, if you would like to introduce yourself and tell us a little bit about your cancer story.
Jim Brauer. I was diagnosed with triple positive breast cancer March of 2020. So just as COVID was really hitting, I had a second mammogram, I think around the 6th or so of March, and they were like, we want to biopsy you on Monday. And I said, I'm leaving in 3 hours for a cruise. So after the cruise, which we luckily were able to get home because COVID was hitting, 2 days after coming home from the cruise, I was diagnosed. I've had over a year of chemotherapy and immunotherapy, 25 rounds of radiation, double mastectomy, and I'm ATM gene positive. The clinical trial that I'm in is a vaccine that is for HER2 positive patients that is supposed to prevent reoccurrence. And I will be having my 5th of 6 doses of the vaccine this month.
That's awesome. And that's exactly why we chose Jen to join us, because cancer vaccines are a thing. They're becoming a thing, and trials are starting. So really excited to hear more about that, Jen. Thanks for joining us tonight. Melanie, would you like to say hi and tell us a little bit about yourself?
Sure. Can everybody hear me? I hope. Just nod, yeah. I'm Melanie. I am a longtime patient advocate, science nerd. I've been living with follicular lymphoma since 2004. My initial follicular lymphoma was treated with radiation therapy. And then I was on watch and wait for a long time, actually, for about 10 years, until the follicular lymphoma transformed into a more aggressive large B-cell lymphoma. So I remember my doctor saying, like, now it's like you have 2 cancers. And I was like, that's great. But it's pretty common for follicular to transform, but becomes more serious. And so then I went through 6 rounds of R-CHOP and have been in remission from both cancers since then. That's been about 5-6 years now. But the follicular is expected to come back, like it's one of those incurable kind of long-term kind of cancers. So it's really interesting experience to have gone through. I've been living with this for a long time. And over the years, I've shared my particular cancer story with lots of people. I kind of learned early on that people really, it sort of helps to talk about it, and people really help with giving advice and getting advice. So I participated in patient research about the follicular lymphoma journey. And as a parent of a child with a rare genetic disorder, I've also participated with him in clinical trial research as well. So I kind of had that experience both as a cancer patient, but also as a parent, and kind of what goes into that clinical trial research as well for kids.
Thanks for sharing, Melanie. So Melanie's participated in research with Grit Health, so we were happy to have her on, and then her experience, although might not be cancer, but with her family, being knowledgeable on that. So thank you for sharing, and we're happy to hear you've been in remission for a while. That's great news. So let's go ahead and turn it over to Robert, if you'd like to say hi and tell us a little bit about yourself.
Hi, everybody. Thanks to Grit for hosting this. I was diagnosed with melanoma in 2013 and was staged as malignant melanoma stage 3, and had a couple sort of aggressive surgeries to address it initially, and then was recommended to go on what was then the standard of care treatment, which is called interferon, and evaluated at the time the statistics around that, and they were pretty grim. They were a brutal treatment that doesn't add too much to survival period. And so I then researched clinical trials, did the clinical trial at UVA in Virginia, which is not where I live. I live in Austin, and was then no evidence of disease for a couple years. And then it did progress, although it was a pretty mild progression, but it did progress to stage 4. Had another surgery, and again, anomalously, even though it progressed, it actually hasn't done anything after that additional surgery. So I've now been no evidence of disease for since 2016 after that secondary surgery. And then that gets us to today. I currently remain no evidence of disease, and the clinical trial I was a part of, I've now rolled out of. It's only a year interview that I have with them, and the initial findings from that particular study have been published, and there's more to come as they continue to analyze results. And that's all.
That's awesome. Thanks for sharing, Robert. That's a really important part of participating in research, to know, hey, what are you learning about me, and what's going to come out of everything you learned, and, kind of knowing where your trial stands today. That's really great. So thank you for sharing. And then last, but certainly not least, a friend of mine, cancer friend of mine from the cancer world, Jeff, if you want to say hi and tell us a little bit about yourself.
Hey everybody, I'm Jeff. I'm coming to you from North Carolina, so if I sound a little bit southern, that's why. Was first diagnosed July 17th of 2012 with melanoma. At the time it was stage 2, quickly advanced to stage 3. And upon scans for the melanoma, they found thyroid cancer, which was a completely secondary primary cancer. So I had 2 primary cancers. In the last 9 years, I've been diagnosed 6 times, 2 recurrences of melanoma, 2 recurrences of thyroid. I was stage 3 thyroid cancer, and I'm currently stage 4 melanoma. In treatment, it has spread to the brain, chest, and abdomen. In that 9 years, I've done 13 surgeries, 142 chemo and immunotherapy treatments, 20 direct radiation treatments, 2 rounds of radioactive iodine, and currently on a 1.5 years of targeted therapy. So my research experience is a little bit different because of having 2 primary cancers. I was not eligible for any of the clinical trials that they wanted to try. So my research comes in through a program through UNC that looked at health and wellness for cancer patients that utilized health coaching and Fitbits to increase the fitness levels of cancer patients. So a little bit different. And if you hear a dog barking, that is my buddy Noma. He will probably join in at some point. He is actually named for my cancer. So he likes to join in. So
Thanks for sharing, Jeff. Yeah, so you can already quickly tell we're not even a quarter way into our program tonight, and it's just really evident that cancer research can mean so many different things, and that, you know, each one of you has a completely different story to share, an experience that deals with cancer research, but really highlights all the different ways. So, you know, Melanie, you made a really great point that patient experience research is a way to share your story and use your voice to really make changes in healthcare. And Jeff, the study you're doing for, you know, exercise and well-being, that study you participated in really shows, you know, even outside of treatment and medicine, there's, you know, more things you can do to give your impact and let scientists and medical teams learn more about you. And then, of course, Jennifer with the vaccines, and then Robert with the, you know, clinical trials. So really incredible. I'm excited. This is great. More than I could have asked for to have my variety to really show what cancer research is. So, and then totally up to you guys as speakers. I'm just going to ask questions. And if you want to chime in, go ahead, unmute, wave at me, whatever you see as applicable to your experience. But my first kind of question is, so the research that you are currently in or were previously in, how the heck did you even find it? That's my first one. Jennifer, go for it.
I was trying myself to look for things, and I actually found it on Facebook. It was in one of the breast cancer groups. Someone mentioned this specific study, and so I looked it up, and I'm in Michigan. There were 2 locations I thought were close enough for me, Columbus, Ohio, or Indianapolis, Indiana. And I kept calling and didn't get through. And then finally I got through for Indianapolis, and I got the medical surgical floor for the hospital, only to find out that the person listed as a contact had moved. They had not updated the information on clinicaltrials.org and gave the phone number, obviously, to someone else. So once again, thanks to Facebook, I got the correct information for the nurse and took off from there. So it is something I will say, on the clinicaltrials.org website, information does not always get updated really fast about new contacts and new phone numbers. Like, I brought it up to the surgeon that's heading the trial in Indianapolis, and within a day it was updated. So use Facebook, use social media, try to use your doctor's offices, whatever you can, if you are getting that roadblock, is something I always say.
Yeah, that's crazy. Yay for Facebook. Love-hate relationship with social media, but I know in the cancer world, it can definitely be a good thing, a good resource. Melanie, I see you unmuted.
Yeah, I was going to say, one of the things, in addition to the clinicaltrials.gov, is that I found that by going to certain advocacy groups that sort of specialize in those areas, they tend to have maybe more targeted clinical trials that it's just sort of a smaller list. Not everybody has them, but, you know, for my son, there's the Children's Tumor Foundation has an email list that you can kind of join, and they send out stuff, they send out like clinical trial updates. And so, I always kind of scan through them when they send out the email, I don't know, whenever they have stuff to update, but I'll scan through it and I'll see, does he qualify? Is there something here? And so finding those more niche kind of organizations that focus in your particular area has been really helpful for us, because we've done 3 studies and one of them was a clinical trial. we found through the Tumor Foundation, the Children's Tumor Foundation.
Yeah, that's a great point. Dr. Dan Platt, our chief medical officer, and I have done a really long interview kind of style, just chat, him and I, of really walking through all the different ways you can at least start to try and find different clinical trials, and the types and the phases and what in the world all that means. And, maybe clinicaltrials.gov isn't the easiest place. I think any of us who've ever looked at it know that. And if you don't know that, look at it, and then you'll leave the website really fast. And then exactly like Jennifer said, it's not always up to date. So using, other avenues and other resources that Dan and I have covered in the past can definitely be a good tool there. Jeff, how did you find your research study?
So I have a very wonderful care team at UNC. And part of that care team is actually 2 oncological psychiatrists. And being a male, that was tough for me to go see a psychiatrist because, as a male, society thinks that we're supposed to be able to handle everything on our own. And cancer has taught me that I can't. So one of those oncological psychiatrists recommended me for this program, and I was able to get involved in it. And it was through the hospital. And she's really good about looking for treatment options that don't include medication solely. So this was kind of a twofold thing because it did offer some treatment as well as an opportunity for the university to do some research.
That's a great point. Yeah, that there's different ways to find stuff. You're exactly right. And having your care team really listen to you and finding a care team that'll give you different kinds of options on different things. Robert, you want to chime in and tell us how you found your clinical trial?
Sure. And just hat tip to Jeff. I'm so glad you got the perspective you needed. I certainly have benefited from seeing having a therapist in this process. So I'm glad that it has also been beneficial for you. So I had a bunch of safe searches on clinicaltrials.gov because I had made the decision that the standard of care didn't seem to be effective enough. And if I was going to go down, I was going to go down for science. And the trials that I saw a couple that I thought might be relevant. And I went into my doctor and just said, hey, here, I see a couple trials. I think they may be relevant for me. And in fact, his advice was that they weren't quite right. But the more important development was that the fact that I even brought them to him really surprised him. Even though he is a doctor who participates in and leads research, I think it really took him by surprise that I was willing to consider clinical trials. And so then during that session, he did his own searching, found one that I had missed. I don't know if he had a different portal that gave him visibility into something different, or if I had searched poorly or just missed it or whatever. But he saw one and said, so since you're interested, this is one that fits you well, and I think we should do that. Let's see if we can get you in. And so, how I got in was really, though I searched, it was really just the fact that I was searching that was the difference maker to my care team. And then they were enrolled in searching with me, and really they found it, not me. And of course, it was up to me to fill out all the damn paperwork and all that. But they were the ones who identified the opportunity after I took the chance to say, I want this, help me find it.
Great. Thank you for sharing. Yeah, that is, Dan and I have talked about this a million times, that even looking a little bit, familiarizing yourself with terms and background knowledge, and then walking in one day to your oncologist or whoever it may be and saying, hey, look what I found. What do you think? It might not be on their radar, might not have known that's something you're interested in or willing to do. And, what's the worst somebody can tell you? No. All right, fine. I'll find something else to ask you about. So that's great.
I was surprised actually that I guess I was surprised that my doctor didn't bring it up more. I remember asking at one point, like, what about clinical trials? And it was his response was kind of like, oh yeah, there's maybe some, we'll see. I think as sometimes as patients, we're sort of conditioned to like let the doctor bring it up to you, and then they don't. But I think that, we don't have to wait. You know what I mean? Like it's, when you sort of take it into your own hands and say, you know what, I'm going to look. That you might not have found those trials otherwise because he wasn't aware.
Right.
Yes, and something else you're saying there, talking about in terms of doctors, I always remind people that yes, ask your doctor about the clinical trial, what they think of it, but ultimately you're the one that's signing the paperwork, not the physician. So unless your oncologist, your surgeon, whoever can come up with really good reasons why not to do a clinical trial, I remind people you don't need your physician's approval. You're the one that's signing. It's ultimately your decision. Like I asked my oncologist about it, and his reaction was, yeah, I have a patient that's doing something similar and goes to Mayo Clinic in Minnesota. And that's all he said. So I said, so basically, if I want to do it, you don't have a problem with it? And he said, it's your decision.
That's great input. And I just know from Jen being a great community member at Grit Health is she's a huge advocate for bugging the hell out of your doctor, and, finding a care team that will listen to you and answer questions. And if you don't get any kind of answer, go ask somebody else. So it's, it's hard because sometimes as patients and survivors, the burden's put on us. We have to ask the questions and we have to look into all this. But hey, if my doctor's not doing it, I'm sure going to do it. So thanks, guys. Next kind of question. When you participated or while you're participating in the cancer research, what kind of pros and cons did you see? Because I know I've heard different things from people of, free treatment, free medicine. I get a whole new slew of healthcare people on my team, or, it was hard to get in touch with them, or, whatever it may be. Not necessarily if you loved it or not, but, what kinds of things did you see while you were participating?
I mean, there's a ton of paperwork. I was really alert to how, just how much labor you have to do to get into a clinical trial, and it was worth it. I don't regret it for a second, but I am just really alert to the fact that not everyone would have that opportunity to spend the time that I was able to spend doing that paperwork. And so one challenge was doing all the paperwork. Another challenge was the expense. So of course the stuff associated directly with the trial was free. They certainly weren't paying for me to travel out there. And that was an immense cost. And I was lucky that I had a community that sort of supported me at the time and helped me cover those expenses. But the transportation was a real challenge. And I was even luckier still that I had a place to stay with a buddy who lived not too far. But was really alert to how fortunate that was. And there was one point where they weren't available, and so I stayed in a nearby sort of hostel thing. And I was very grateful for it that night. It enabled me to stay in the trial. And yet it was it was a far cry from a really hospitable environment for the care. And so, I mean, all of it just feels like a bit uphill. At the end of the day, it feels very worth it. Another thing that was sort of a downside of it, I suppose, was that they were really, the team was in it to do their research, and there wasn't human care that was really part of it. And it was okay because I knew that they were there to figure out the things and support the outcomes. But for that kind of personal touch and care, I just needed to go somewhere else. That said, everyone was polite and professional, and going through it was very much worth it. But I think there's a lot of impediments that it would be good for us as a society to reduce and make it easier for people to be in clinical trials.
All great points. Yeah. Thank you, Robert, for sharing that. Great insight. And I know at Grit Health, that's one of the things, we work on is, hey, if the trial you're in, you can't find any way to get travel reimbursed. Okay, well, let Grit Health help you find the advocacy organization that might provide grants or gas gift cards or help with lodging. That's really where the advocacy organizations and companies like Grit Health come in and say, you want to go do this amazing treatment, let us help you make sure you can do it. So excellent input there. Anyone else want to share their experience, pros and cons?
One, it's not even a big con, but just something for people to keep in mind. Ask up front what the costs are going to be, because I had a consultation and for getting into clinical trial, and I assumed that would be covered, found out that it wasn't. It was like $362 because it was out of network. My insurance would not pay for it at all. The clinical trial does not pay for the basic blood work that I need before each injection, like the CBCs and things like that, but it's only $13. The rest is all covered, but ask about what is covered and what is not covered. The other thing I just wanted to mention before I forget, always ask if the treatment would be different if you were not in a clinical trial. I mention that because I was actually in a radiology clinical trial for a while, and I had complications and I needed an expander removed, so I wanted to keep my skin as good as possible to continue with reconstruction. And I read all my studies and everything, that the study required 25 to 30. And I was signed up for 30 sessions. I kept pushing, why can't I have 25? The study says 25. Why can't I do 20 regular and 5 boosts to make it the 25? And after weeks and weeks of pestering, it finally came out that, oh, by the way, if you weren't in the clinical trial, you'd be getting less radiation. So at that point, I dropped out of the clinical trial and did less radiation. I mean, you can pull out of the clinical trials, but ask those questions. If I were not in the clinical trial, would I be getting a different course of treatment? How is it going to be different? And just kind of, you got to weigh that out. What is most important to you at that point?
Right. Yeah. And that's a great point. And I know Dan and I stress this again, that you can pull out of cancer research of any time of any type at any time. And nothing bad is going to happen to you for saying, I've had enough of this. I think I'm done. Nothing bad will happen. That is completely your choice, your body. Melanie or Jeff, did you have input to tell me some pros and cons? Melanie, go for it.
Sure. Yeah, no, I can talk specifically about my experience with my son's clinical trial that we did. The pros of doing it was that, there was extra people now looking at, these issues with him. And, it was nice to have sort of an outside perspective that, from the usual doctors and the usual kind of routine. So it was nice. It is a lot of paperwork, and it required a lot from us in terms of we had to travel, and I will say that some clinical trials are better funded than others. So like this clinical trial flew us, we had to go to Nashville. They flew us to Nashville 3 times, or it's set periods of time. We had to accommodate our schedule. And I think, Robert's point is kind of true. It's like, their focus is what they're trying to study, and, you're helping, but at the same time, you're specific, you have to kind of work around what they're trying to do in a way. But, at the end of the day, it still cost us some money. Certainly it wasn't all covered. But, I felt like we were contributing to other research, even if we didn't necessarily benefit. I was hoping that we would benefit. It's still, the jury's still out on it, to be honest with you. I don't think the research is done yet. We were part of a rolling trial. But, there's definitely pros to some things could help, but there's a lot of work that goes into it on your end to kind of keep up with it. And ideally, whoever is doing the study should be helping with that, making it as easy as possible. They don't always. It sort of depends on who's managing it and how well funded they are.
Right. All great points again. Jeff, I see your little furry buddy there with you. If you guys want to tell us some pros and cons that you found during your research study you participated in.
So before the diagnosis of thyroid cancer, I was actually looking at some clinical trials for the melanoma. And I did look at trials that did not have a placebo leg, just because I didn't want to waste, potentially a year of treatment and, miss out on a year of what could have been life-saving at the time. But then, got diagnosed with the second primary, so that kicked me out of that. Definitely one of the pros of the study that I was in is having a weekly meeting with a health coach. In the midst of COVID and all of the shutdowns, it was really nice to have interaction with somebody that was tracking, not only what I was doing from a physical standpoint, but how I was feeling, how I was responding to everything that was going on, and somebody that could directly talk with my medical team and get me the resources I needed if I was struggling at all.
Hey, bud.
So that was definitely a pro, even to the point that my health coach ended up getting me hooked up with palliative care, which my experience with palliative care meant that I was at the end of my life. Come to find out that is not exactly 100% true, because they have a whole lot of resources that they can use just to make things better or more comfortable for you. I go to work every day. I'm not looking forward to leaving Earth anytime soon. But come here. So getting me hooked up with other resources was definitely a pro. And even my oncological psychiatrist is now trying to push me to become a part of the study from the other side, to where I'm actually doing some of the health coaching for new participants. So I'm looking into that as well.
That's awesome. Yeah. And again, like I said in the beginning, just goes to show that, cancer research doesn't always mean clinical trials and new treatment options and drugs and, travel and this and that, they really do look at your well-being, like what Jeff did, and, kind of that psychosocial element and how you're feeling and your fitness and how things you do outside of treatment can help. And then I'm just so pleased to hear that they were able to kind of break those barriers for you and your misconceptions about palliative care, and that you could get more resources. So that's really, really powerful. And then getting to help with the study after, that's golden. That's awesome that you can help other people too. I love that. So, and also if the audience has any questions, feel free to type them in the chat at any time and we can ask them for sure. So something else I wanted to ask, and again, answer, whichever one of you feels like answering. Did you learn anything from participating in cancer research? So whether just personally about yourself, more things out there, learn more about your actual disease. What did you learn?
For me, definitely I'm learning more about the immunotherapies that are out there, because that's what my vaccine is about. And I was just thinking, the pro for me being in the trial, I'm in a phase 2, so there's only 110 people that are accepted for it, and I get to be one of them. So I think that's kind of cool. And I'm also knowing that this is cutting edge technology science. So it's going to be, unfortunately, probably going to be helping my daughter and my sister one day. Another thing that I kind of realize is that my journey for cancer really started changing when I entered the clinical trial, because it was at that point I really started standing up for myself, I think, more. I was stronger. I was past the really bad chemo, so I was feeling better. But I don't always know if my doctors like seeing me on the schedule, because I'm now to the point where I'm going to push for the level of care that I think I need to have. I'm going to push for answers to the questions and not just say, we'll get to it later. I want the answer now. So I think that was a definite plus for my just health journey going forward.
I love that. I love that for sure. I know you were a strong advocate for telling people the same exact thing, to push for things. Anybody else want to kind of chime in and tell me anything you might have learned from participating in research? Robert?
I'll just retweet Jennifer with enthusiasm. I became aware of a whole set of immunotherapy possibilities that weren't on my radar. I was also a vaccine clinical trial participant, and so that broadened my horizons, but also just really coming down strong on my sense of agency and how much it is important for anyone in healthcare to advocate for themselves and to never assume that things aren't slipping through the cracks. I mean, I'm lucky in that my healthcare team is wildly competent, and yet even in their wild competence, things slip through the cracks. And so there was something about my experience at the clinical trial that helped me feel like that I was being and must remain being my own advocate, and to really remain diligent and kind of make sure that I'm forcing them to cross every T and dot every I and recognize that that's okay. That's part of the relationship. It's actually a healthier relationship than just being a recipient of a kind of paternal medical system. So it was a real shift in mind and me taking ownership over my process through healthcare from that point on. So it's a very long-winded way of saying I strongly agree with both of Jennifer's points, and they applied to me.
Yeah, thank you for sharing, Robert. And, you know, for some of you that always attend Grit Health events, I might sound like a broken record, but one of our huge things that we do at Grit, and that I'm always, you know, telling people is, you know, it's your body and you need to advocate for yourself, and using your voice through all these different types of research, or even attending and being supportive to somebody else, that's you using your voice. And whether that's helping others treatment down the road 10, 15, 20 years from you, or could help somebody today. So it's really, really great. Melanie, did you want to chime in?
I did, yeah. I just want to say a little bit, because some of the research that I participated on for myself has been more along the lines of patient research that has been done by various folks. I've done like lots of interviews, and I think what I've learned through that process is, you know, I guess there's a finite amount of people who have these experiences, and so we really do have something to say. You know, we really do have like real lived things that we could share with people that could make things better. And so I feel like I've learned a lot from that process in kind of like using my voice to say, like, you know, this is how this works, and this is how things should change, and this is, you know, like, we shouldn't have this kind of paternalistic, you know, approach, and the doctor should be listening to me, and we should have this back. You know, there are things like, as far as just patient research that I participated in about, like, you know, follicular lymphoma or lymphoma in general. You know, we have a lot to say, and I think it's important to share that, and I think it will make a difference in future medical treatments, you know, more than, you know, in addition to clinical trials.
Right, exactly. Dan, I know you're not part of our speakers tonight, but let me throw something your way because you're here. Dan Platt's our Chief Medical Officer. And so Melanie was kind of talking about this patient experience research. So Dr. Dan, just wondering if you could kind of just give us a little blip of what patient experience research is and how that participating in that can actually change how trials are run and how drugs are developed, and these essentially maybe some complaints or, maybe that little cons list about the trial you participated in. How can we make that better?
Yeah, Lauren, thank you for asking. I'll let Melanie get into the intricacies of what she participated in. But really, what we're trying to do when we do these type of projects is bring the patient input to bear on how a trial is designed and run. And so the big things in trial design are, what can we do to push drug companies and the government to do a better job at setting things up for patients, making it easier to find trials, making it easier to get into trials, making it easier to pay and afford trials, and how can we make that how can we make it available to anyone who wants a trial, and make people who even might not want a trial, give them the information they need to really come to an informed decision about that. How do we get away? How do we get rid of all the mythology around what clinical trials are and what they really are? Get rid of this idea that if you're a cancer patient, you're going to get a placebo. It's a thing that a lot of patients don't quite understand how placebos are used in trials, and that they're really every cancer trial you're going to get a treatment because of the nature of the disease. And so understanding these things is really, really important. So what can we do to get more patients in, to make sure that they're having an effect on the trial design, that the information that they have and that their experience is getting to the people who can actually affect change in the way the trials are done? And then within the trial, how can we make it so that it's more responsive to patients? How can we include things like quality of life in the clinical trials, so that we're not just looking at the effectiveness of the drug and the side effects, but also does the drug, has it improved your well-being? Has it made you able to get out and socialize? Or are you home throwing up all the time and you feel like a hermit? How is it adding to people's lives? And then also bringing in those patient-reported outcome measures, which is an element of quality of life. How can we really make the drug more responsive to the patient rather than the patient responsive to the drug?
Excellent summary. Exactly what I was looking for, Dr. Dan. Thank you. Much more eloquently put than I would have stumbled upon. So thank you. So one other question I have for our speakers tonight, do you have any advice for someone who might be considering participating in research, any kind of research related to their cancer? If they're kind of on the fence, if they've thought about it, if they're worried, scared, what advice do you have for people thinking about taking the research plunge?
I will start. I would say it's your choice. I think that's the important thing to put out there. I think there's this sort of understanding, or there's this idea that, a clinical trial has to be like when you're at the end of the line and there's nothing else. That doesn't have to be the case. There are clinical trials that are, that are going on about health issue or mental health or, physical health. There are clinical trials that you can join, that it's your choice to do, when you want to. If you want to, you can always drop out if you don't want to. And so I think just remembering your own agency in those processes is the most important thing, because, it is a choice. You can do it. You don't have to do it. And you might find something that's really great and you might not, but, ask questions. Certainly ask, Jen has great questions to ask, those are really, it's really important to just have that, know that you have that agency. You're not alone in this process, but you have that voice for yourself.
Right. Great point. Anybody else from Jeff, go for it.
Yeah, definitely be your best advocate. I never knew until I was diagnosed how many Facebook and Twitter doctors there were out there. or how many people's cousins, aunts, uncles, whatever, were treated with some kind of, crazy, concoction that magically cured them. And everybody is going to give you their best advice, but you have to do what's best for you, and do quality research prior to, not, Wikipedia or any of the lovely stuff online. Actually do the research that's quality. Find a medical team that you trust. If you're not getting the answers you want from the medical team that you're with, there are plenty of doctors out there, and I don't think any doctor will take offense if you go for a second opinion. So those are big things. And then, find something that is going to benefit you, for what your needs are, whether it's treatment, whether it's, quality of life, what have you. Find something that's going to be beneficial to you. And the other thing is, I would include caregivers in that plan as well, because there are some legs of research out there that do involve caregivers as well.
Thanks, Jeff. That's a really great point, that there are different research studies that are actually for caregivers, so if you had your right-hand man or woman that was helping you out during treatment, and they went through hell and back with you, there are research studies out there where we want to know and hear from the caregivers and get their perspective and actually make the caregiver experience better too, not just patients, not just survivors. So I'm really glad you actually mentioned that, Jeff. Thank you. Robert, any advice you would have to somebody?
I mean, I just could not possibly be a more enthusiastic advocate for clinical trials. I think that careful, peer-reviewed, structured research in the medical field is why any significant portion of us live older than 60 ever. And there's a lot of different ways to leave a legacy. And a clinical trial is one essential way to leave a legacy, to add to the aggregation of human knowledge. It's a way of giving back for the finite time we get here. So, we all have to make a personal decision, but I cannot overstate how much I support the at least possibility of participating in a clinical trial.
Right. Yeah, great point. And it's, again, throwing you on the spot, Dan, but something I hear Dr. Dan say a lot, that, clinical trials and, learning about these new therapies and new drugs is literally how science and medicine advances. If there weren't people going into trials and trials couldn't happen, then we'd be stuck with the same cancer care that we have been, that we were at 20, 30, 50 years ago. So it's really how improvements and changes happen. So, Jen, anything you wanted to add for advice you would give somebody who's kind of on the fence on participating in some kind of cancer research?
Remember that you can ask to speak with different people. There's a Facebook page for my specific clinical trial, and she's doing her treatment in Indianapolis, and the physician there that's heading it up is great, but she has some questions that the physician just wasn't 100% certain of. So she actually got Jessica connected with the person that's overall in charge of the study. So don't be afraid to ask to speak to different people, just to get different opinions or different point of views within the same study as well. Just for your comfort level, to get questions answered. Also keep in mind that, not every clinical study is going to have a placebo. Everyone assumes that you don't know if you're getting the real thing or not. No, not necessarily. For my clinical trial, everybody is getting a vaccine. It's just a matter of how you're getting the vaccine. One is pre-made, one is made from your actual T cells, and they're comparing the two to see if there's differences in them. So that's another thing just to look into. Am I getting placebo? Am I actually getting care that's going to help me long-term potentially? Those are just some other things I've thought of.
Yeah, great point. And again, something Dr. Dan and I have covered numerous times of this placebo. So Dan, I don't know if you want to just chime in real quick on what does placebo even mean versus not mean? And then, Jeff, you clearly knew exactly what placebo meant. Well, let's hear Dan's definition, then we'll kind of get into why you probably were looking at things that were not in that direction.
Yeah, Lauren. So I think the best way to explain it is to give an example. So let's say that you are so the standard of care for your cancer is this chemotherapy, or let's even say 2 chemotherapy drugs, call them drug X and drug Y. And a clinical trial comes along and wants to compare that standard of care, XY, to a new drug, and it's only going to be one drug. We'll call that Z. So in order for the trial to be what's called blinded, and for you as the patient and for the doctors not to know what regimen you're on, they can't just give you drug Z or drug X plus Y, because if they give you one drug, then you're going to know you're on drug Z. If they give you 2 drugs, you're going to know you're on the standard of care. So what they do in that situation is they give you drug Z plus a placebo in order for you not to know which of the 2 arms you're on. And they have to do that because if people know, it introduces bias into the studies, and it makes it very hard for the results to be valid. So really what a placebo is a way to make sure that the study stays valid by blinding the participants to know exactly what they're taking. And it's a really important part of clinical studies, but where patients get tripped up is they think that the difference is I'll either get drug Z or I might just get a placebo. And that's never the case. You will always be getting the standard of care plus a placebo, or the drug plus the experimental drug plus other drugs, other chemo that may be grouped with. So that's a really important point to understand.
Right. Thank you, Dan. And then just to point out, because I know, Jeff, you mentioned it when you were looking at trials, hey, I don't even want this placebo option. So it's not that Jeff absolutely knew what it meant. He didn't want to spend a year of his time possibly getting what is at that time the standard of care. He said, pump me full of the new stuff. I want the new stuff and the new stuff only, to really just try it, really go out and put it all out there. So thank you for explaining that, Dan. Before we kind of wrap up, I just wanted to see if anybody from the audience had any questions about participating in cancer research. You can type them in the chat, or since we have a small group, I welcome you to unmute and ask your question as well. So any questions, feel free. And if we don't have questions, that's okay too. I know I have learned a lot for sure tonight. And just want to, ask for any final thoughts from our 4 speakers tonight. If you have any last words. I won't say last words. That sounds terrible, right? Who am I? Don't I work for a cancer company? I shouldn't say your last words. Oh my gosh. But if you have anything else that you'd like to add to what was discussed earlier throughout our hour together, please feel free to unmute and give us some final remarks.
I will. I just wanted to echo what Robert said. I think for me too, like I'll never forget what my oncologist said, when I was first diagnosed, he's like, treatment is evolving all the time. And, and at the time, this was in 2004, like rituximab was just newly on the market, and it's like this new drug is out a year or 2. And, now it's the standard of care. And actually, things are evolving still with lymphomas and immunotherapy. That's, it's still changing. And I've been I've been attuned to this stuff since, since my diagnosis, like 17 years ago, and I have seen the changes that happen from the clinical trial research. And, even to the point where, like, now when I get treatment, it's a totally different landscape than it would have been had I needed something, 10, 15 years ago or 17 years ago. So I feel like I so appreciate the people who have done those trials, and, if there's a chance for me to pay it back in some way, then I would, I sort of would echo what Robert was saying about that legacy. It's a nice way to leave a legacy. And I so much appreciate the people whose legacy I'm benefiting from, going forward.
Yeah, completely agree. Robert, when you said that, man, those were strong, powerful words in a way that I never looked at it before. So I'm really glad you kind of gave us that perspective. So we're getting close here to time. We're not going to get cut off, but I wanted to let you know, Chris, I'm going to put you on the spot to throw some fast links in the chat for me. But if he's not fast or you're not fast, that's okay, because when you get your email from me in a week or week and a half, I will include this information as well. But wanted to, of course, let you know that we have registration open for our 3rd annual Global Virtual Cancer Conference. That's happening in November. And we actually have 1 or 2 really awesome sessions during our conference that really dig a lot more into clinical trials. So that I'm excited about. So that is open. And I believe if you register now, like really, really soon, I think we still have some free swag boxes to mail out. So I think we have a few left. So if you haven't registered already, you can get, like, I don't know, you didn't hear from me, but maybe like a really cool Grit Health hat, like a cool hat, not a boring hat, of course. And then also you can always visit grithealth.com/events, where you can register for our other upcoming programs. I think the next one will be happening October 19th, the 3rd Tuesday. That's our member meetup. So that's happening. And if you, just to add, and I'll hopefully remember to write this in my email, if you're in a spot where you're teetering towards what's out there in the research world for me, I know something Dan and I are really passionate about is, if you have questions, or, we hear tonight, be your own advocate, ask questions, do your own research. If you don't know how, or you need help, let me know. Dan and I will meet up with you, well, on Zoom, of course, and we'll talk, and we can absolutely help you help yourself when it comes to learning more about research. And then, of course, I wanted to mention too, Dan kind of touched on it, the patient experience research that Grit Health does. We call that the Grit Project. That is our research initiative here at Grit Health. And so if you ever thought about patient experience research, or, hey, I want to do a survey or be in a focus group, or I want to complain about how shit my cancer journey was, guess what? You can do it and make changes in healthcare through the Grit Project. So what you do is you just kind of sign up, and then if research opportunities come up that might apply to your cancer type, then we contact you. Really easy process. And we don't spam you with a bunch of stuff either, I promise. And then I also wanted to let you know that we are looking for patients who are considering participating in CAR T cell therapy clinical trials within the United States to participate in virtual engagements about their experiences and unmet needs. Participants will be compensated for their time. For more information and/or to participate, please contact us at projects@grithealth.com. So wanted to share that bit from our research team. And then, I have to have my very specific blurb given to me by the research team. So sorry for sounding a little silly there. But I was reading my script. I was following the rules. Thank you again. This was great. I loved hearing from each of you. Jeff, Robert, Jen, Melanie, thank you so much for showing up tonight, sharing your experience, and telling us the ins and outs of why you participated and what it was like. And also, Dr. Dan, thanks for chiming in too when I threw you through you out there to answer some questions for us. So like I said, email coming, which will include this recording and some other information that I'll find for you guys. Thank you again. And I hope if you learned anything tonight, it's that your voice really matters, and your voice can really empower yourself and empower others and ignite change in the healthcare world and make cancer care better for those after us. So thank you all again so much, and I hope you have a wonderful night.